Good morning, everyone. I am Dr. Pradeep Daniel from the Department of Pediatric and Preventive Dentistry. I will be talking to you about diet counseling. So, before moving on to diet counseling, we should know what nutrients are. So, nutrients are defined as the constituents of food which perform important functions in our body. Nigel in 1989 he gave a definition for diet as the total oral intake of a substance that provides nourishment and supply. Stewart gave a definition for balanced diet as the one providing each nutrient in the neither deficient nor excess needed to maintain the optimum health. Optimal growth and development are primary objectives of pediatric nutrition, and food is merely a vehicle for nutrient delivery, and the nutrients provide energy for growth, serve as structural components, and participate in all metabolic functions of the body. Food, however, is more than just nutrients; that is, sensory, emotional, social, and cultural associations influence the food choices. One of the key focuses with dietary counseling is making a step-by-step approach so that changes are achievable in the long term. Any changes that are made might be done over a number of weeks, so attaining your main goal is more manageable. Dietary counseling can help putting a healthy diet in place for an individual and or a family, losing weight, or simply feeling better by eating better. So moving on to patient selection, we should all know that diet counseling will not succeed with every dental patient. Potential candidates for counseling should give high priority to preventive dentistry and should be willing to expend long-term efforts to maintain their natural dentition, good health for a lifetime. In addition to a positive attitude, they should have a demonstrable need for dietary improvement based on their current food intake regimen. So, diet chart. A diet chart concerning food intake patterns, diet adequacy, consumption of fermentable carbohydrates, which includes naturally occurring and added sugars, and the use of fluoridated toothpaste is a strategy for healthcare professionals to determine the diet related key risk habits of an individual. So, if the child is young, the mother usually completes the food diary at home, writing in food after they are eaten. The patient is instructed to be as accurate as possible in determining the quantities and to record the detail everything eaten or drunk during or between the meals. The size serving in household measures and the addition of sugar, milk, syrups to anything consumed should also be recorded. A food or dietary diary can be either 24 hours or a 1 week chart. So here is an example of a diet chart taken in an American kid. So we can see that the scores are given according to the type or form of the food which is intake. So liquid forms of sugar are given a score of 5, solid and sticky foods are given a score of 10, and slow dissolving foods are given a score of 50. So the total score are calculated and the inference is such that if the score is 5 or less, the patient is given a excellent grading. If it is 10, they are given a good grading. But if it is 15 or more, the patients are in the watch out zone. So moving on to communication techniques, it is very important and there are three basic rules for the communication techniques. They are for motivating the behavioral change. It can be either non-verbal or verbal, and the personalization of the message is more likely to result in a sustained change in behavior. So communication techniques are useful while interviewing, teaching, counseling, and motivating the patient. So moving on to interview. So what is the main purpose of an interview? First and foremost, the dietary interview can serve as a valuable diagnostic aid. Food selection and eating habits may affect a person's dental or general health or both. So appraisal of an individual's dietary status may provide a clue to potential difficulties. The secondly, knowledge of a person's daily routine is important for adapting the caries preventive diet to an individual's lifestyle. So ideally, as the professional authority, the dentist should be the diet interviewer, but it is probable that he or she will not be able to give adequate time to this phase of preventive services. Consequently, the clinical dental nutrition services probably will be assigned to a dental hygienist or nutritionist. In any event, the dentist is responsible professional who must reinforce the advice given by the dental hygienist or nutritionist at the checkup visits. So, privacy is very important. A comfortable and relaxed atmosphere are important requisites for an interview. The interview should not take place in the chair side in the dental operatory, as it can be threatening atmosphere that may lead to fear and withdrawal. It should take place in a separate counseling room that contains a small conference table, few chairs, a blackboard, and visual aids. So even with various visual aids available, teaching will not be effective if the information is not presented in small increments. So if the patient does not understand the explanation, it should be repeated. The next level should not be attempted until the previous level is fully understood. So an important advantage is listening before speaking, as the patient himself may reveal answers to his problems and provide a direction for the course of action. In general, the interviewer should be encouraging and sympathetic and should not assume an adversary position. So we should allow the patient to make choices based on what has been learned and with which patient can cooperate. So moving on to teaching and learning. So the patient's education is more than just simply giving information. It requires the presentation of information with sufficient impact to stimulate the action by the learner. So a number of teaching aids may be used, including booklets on nutrition and dental health, which can be purchased at a little cost. Moving on to counseling. Approaches to counseling may be either directive or non-directive. So in directive counseling, the role of the patient is passive and all the decisions are made by the counselor. In non-directive counseling, the counselor's role is merely to aid the patient in clarifying and understanding his or her own situation and to provide the guidance respectively. So what are the guidelines for counseling? First and foremost, information gathering is important. The person's personal identifying data, likes and dislikes, and the patient's perception towards their diet should be known. We should evaluate and interpret the information, that is, relative adequacy of the diet and eating habits should be known. We should develop and implement a plan of action, that is, qualitative modifications to the existing diet. Seek active participation of the patient's family in all aspects of dietary changes and follow up of the progress made over a period of time. So what are the pre-requirements of counseling? So first and foremost, we must elicit a true response from the patient. So if the counselor is hoping for truthful responses to his questions, he must follow some simple rules which will relax the patient. It is important to give neither positive nor negative feedback when the patient is recalling his food intake. Since the people tend to avoid negative reinforcement and seek positive reinforcement, they may alter their responses in pursuit of these goals. So we should also phrase the questions correctly. We should never put words in the patient's mouth. So here's an example. We should ask questions like, what did you put in your cereal, rather than did you put milk in your cereal. Instead of getting a singular answer, you can get a wide range of answers if you phrase the question correctly. We should listen and wait for an answer. So when you ask a question, give the patient some sufficient time to think of its answer. You should never force an answer. Next is motivation. So motivation stimulates or is an incentive for action. With the counselor's positive attitude and conviction as to the necessity and effectiveness of nutrition, counseling can stimulate the patient to initiate an improved dietary pattern. So moving on to motivating patients to modify the food habits. First, you should bring about awareness to the condition. Awareness is nothing but the recognition that the problem exists, but without an inclination to solve it. For example, the patient will come to know that hard candies produce acid, which will cause his tooth to decay. Next is developing an interest. Interest is nothing but the greater degree of awareness, but still with no inclination to act. For example, the patient will think like, maybe I should give up on hard candies. I do not want any more sensitive or painful teeth. Next is getting an involvement from the patient, which is a definite intention to act. For example, the patient will think like, I will definitely give up on hard candy. Next is action, which is a trial performance. For example, the patient will tell you like, I had given up on hard candies and choose sugarless gum instead to prevent the dry feeling in my mouth. Next is the development of habit. Habit is nothing but the commitment to perform the action regularly over a certain period of time. For example, the patient will inform you like, I have not consumed hard candy in the past 6 months. So the principles of diet management. The prescribed diet should vary from the normal diet pattern as little as possible. The diet should meet the body's requirement for essential nutrients, and the prescribed diet should take into consideration and accommodate the patient's likes and dislikes, food habits, and other oral and environmental factors as long as they do not interfere with the objectives. So, if we do an effective diet counseling, it helps in improving the general as well as the dental health. In addition to other caries preventive measures, it should reduce the caries recurrence significantly, and the objectivity, personalization of the diet, and the time spent in counseling are rewarded both financially and by the satisfaction of performing a useful dental health care and preventive dentistry service. Thank you for your valuable time in listening to this presentation.